My name's Penny Smith and I'm the Director of Nursing Leadership for the South West region for NHS England. And part of my role has been to chair the Regional Nursing Midwifery Supply Board. And that board has been constructed to oversee the domestic supply of future nurses, but also to look at how can we attract and encourage internationally educated nurses, midwives and other allied health professions to work in the South West. So obviously this is part of a much bigger programme, so it's a national programme, but we're really proud in the South West that we have worked with North East and Yorkshire to really develop the Stay and Thrive programme. What we recognise is internationally educated nurses are really important to the delivery of services in England at the moment. Never more have internationally educated nurses been so significant as part of our workforce. If you look at the NMC data, we've had a really significant number of overseas nurses join in the last year to 18 months. And what's key is that that not only do we attract really great people to work in the region and nationally, but that we support people to stay. And not only do they stay, but they actually continue their excellent development and can progress in the NHS. In any intervention, in any improvement plan, it's always important to look at the evaluation. We talk about positive deviance, so in other words, learning from people who are doing particularly well. People trust systems that are doing particularly well. But there is a counter narrative to that, because you will also hear anecdotal stories of individual episodes of racism. And I think we need to be really mindful that we truly listen to both aspects and properly respond to both aspects. Some of the work that helps us really understand the impact of the work we're doing is the work with Huddersfield University. And that looks not only at things like communication and the art of language, making sure that individuals and organisations are properly prepared, that we are looking at personal, social, cultural reality. So and that's a very wordy way of saying, you know, actually we're now recognising that NHS services may have a higher percentage of staff who are from the global majority than are part of the local population. So we really need to understand the relationship between things like the staff survey and people's feedback about any racist experiences they've had. And it's interesting, we shy away from using those words, but it's really important that we don't, and that we are actively anti-racist in this programme as we are in many others. So this programme is part of a bigger piece of work around how we retain our excellent staff, but recognising that there are significant additional supports that may be needed for people who are new to the country. And that's not to do with clinical competency, that's not to do with clinical skills or expertise, that it's very much to do with supporting people feel part of the community, to feel part of their team, and to adjust actually to sometimes quite a significantly different culture in terms of the NHS. I'm often thoughtful about the fact that we have a very different language, and it's not necessarily a clinical language, it's about all of the acronyms and all of the way we describe the NHS, and that in itself can be really challenging. So it's been amazing actually working with another region and with Horizons to really think about how do we learn from those that are doing their best. Very often in the NHS we will focus on things that are going badly wrong, and of course that's important to understand from things that go wrong and learn, but it's equally important I think to look at those that are doing really well. And we've got some outstanding examples in the South West of where people have really come forward to learn from and be humble. The humility for people to say we need to do better has been amazing. And actually seeing the leadership that's coming forward from internationally educated nurses to lead the programme is outstanding as well. Where, for example, there is a greater percentage of people from the global majority than in the local population, that we properly respond to the thoughts of the local population, but that integration is much, much wider than it is just about integrating into your team within a hospital or within a service. This is about the place where you live, where you socialise, where you buy your food. You know, this is absolutely integration. So some of the stuff we've seen has been so supportive about that broader integration. Looking at making sure there's suitable support for integration. So again, trusts we've seen that really develop well have invested in those roles. So you've got a named person. Not only have you got your line management structure, your broader social group, hopefully, but there are named people that you can go and connect with. So all of those factors are being looked at through the research that's being led by the University of Huddersfield. Some of the expected positive impacts of the Stay and Thrive programme, it goes right the way through, and most importantly, it's about the impact it is for individual people coming to work in this country. Things like making sure that it impacts on policy change. And so really building a community and a social movement to create a wave of positive examples that will impact on policy, and also making sure that it impacts not only on things like staff survey, but on things like res data. So one of the things we know is that people from the global majority can stay at a junior band for longer than their white counterparts. And so this programme is looking to shift the dial on all of those key metrics which play through to individual experience. But what's really important is that what's good for internationally educated nurses will be good for internationally educated midwives and allied health professionals. But the whole purpose of this was the spread and scale in a really meaningful way into the rest of the regions and England. And to this end, there will be a sharing day later in June, and resources will be put on NHS Futures. And those resources are purposefully quite simple to access, and also I think are designed with the end user in sight. So in other words, they're simple to use and implement, and really should play into those broader retention plans that we expect of high performing organisations. So I think if they should be accessible for anybody at any stage of their career, HR departments, ward managers, person in practice. I would encourage you to really have a good look and to join in that further day and really make a difference. Internationally educated nurses I've spoken to come with a wealth of clinical experience, and having worked in different health services will, I think, become increasingly important. So truly listening to the strengths, not only clinical skills, but perceptions and understandings of how different health services run is going to be absolutely key. I was talking to somebody about prevention much more in terms of infection prevention control and sort of infection management. And in many countries, that has to have a much more public health focus. You know, in some places, resources are more limited, not always, but that brings with it a level of innovation and prioritisation that we really need to learn from. We have to be really humble and say, what can you show us, not only about your clinical skills, but how we can change as a service. And it's that whole concept of global health and reciprocal learning. And I have had the pleasure of working alongside some nurses, internationally educated nurses. I think the levels of professionalism are amazing, taking time to really understand the breadth and strengths and values of people coming to work with us is key.